influenza is widespread in most of the United States.
H1N1 is closing schools in places like Texas and Virginia, but other regions are still waiting for the virus to show up again.
We're not seeing H1N1 influenza in New York City right now.
CDC data shows last spring, New York and New Jersey were especially hard hit, but have been relatively spared this fall. The opposite is true of the Southeast, which saw fewer cases last spring, but is now seeing an H1N1 surge.
One of the current ideas is that wave of this virus last spring has left a number of people protected who are immune from the virus.
This protective effect is called herd immunity. When enough people are immune, either through previous infection or vaccination, the virus does not spread easily.
In places like New York, in the Northeast, there's probably a substantial amount of herd immunity right now, which is dampening the spread of the virus. Doesn't mean it's not going to appear. My guess is it just means that it's going to appear later, and maybe not quite as bad as it is in the Southeast right now.
Experts say the best way to increase herd immunity is vaccination. Maggie?
But help me understand something, John. If the H1N1 virus isn't so bad in the areas that have already been affected with major outbreaks, do people there really need to get vaccinated?
Maggie, the CDC is telling me yes, because even though you may think you had H1N1, you cannot be absolutely sure unless you were specifically tested. And most people were not specifically tested. So the CDC says go ahead and get the vaccine if you are in the subgroup for which it's recommended.
All right, Dr. Jon LaPook. Thank you, John.